Welcome to this review. This is the third and final installment in our series on diabetes. In this review, we're going to differentiate between the typical presentations of type 1, type 2, and gestational diabetes, and we'll explain the pathophysiology for the key symptoms along the way. All right, let's dive in. Let's start with the core definition. Diabetes mellitus is a metabolic disorder characterized by chronic hyperglycemia, or high blood glucose. The symptoms of diabetes are caused by 1. The direct effects of high blood glucose on the body's tissues, and 2. The body's inability to use glucose for energy, leading to cellular starvation. This review will detail the clinical presentation of diabetes, emphasizing the critical differences in onset and severity between the major types. Before we get into the different types, I want to include a quick disclaimer. This review is for educational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. With that said, let's go. First, let's look at type 1 diabetes. The onset is typically acute, rapid, and often dramatic, especially in children and adolescents. The classic polys, that's frequent urination, excessive thirst, and excessive hunger. First, let's tackle polyuria, or frequent urination. This occurs because the kidneys, which are responsible for filtering waste products out of the blood, reabsorb most of the glucose back into the bloodstream through specialized glucose transporters called SGLTs. When there's too much glucose in the blood, though, the amount of glucose in the kidney filtrate exceeds the reabsorption capacity of the SGLTs. As a result, glucose spills into the urine and pulls large volumes of water with it, causing increased urine output. Next is polydipsia, or excessive thirst. This is the direct physiological response to the dehydration caused by polyuria. Finally, polyphagia, or excessive hunger. Despite high blood glucose, the body's cells are starved for energy because the individual does not have enough insulin to allow glucose into the cells. This cellular starvation triggers intense hunger signals. It's important to note that people with type 1 diabetes don't have enough insulin because their immune system has mistakenly attacked and destroyed the beta cells in the pancreas that make insulin. Without insulin, the body is unable to properly metabolize carbohydrates, and so it turns to burning fat and producing ketones for energy. In fact, many patients with newly diagnosed type 1 diabetes will present with diabetic ketoacidosis, or DKA. DKA is a life-threatening complication of diabetes that occurs when there is very little insulin in the body. The blood becomes very acidic as the body tries to get rid of the extra ketones, which can cause nausea, vomiting, abdominal pain, and a fruity or acetone-like odor on the breath. Patients will also experience deep, labored breathing, known as Kussmaul respirations, in an attempt to blow off the excess carbon dioxide and restore the acid-base balance. DKA is often the first sign of type 1 diabetes in children and adolescents, but it can also occur in type 2 diabetes if that type is not well managed. Now let's look at type 2 diabetes. The onset is typically gradual, subtle, and insidious. Many individuals are asymptomatic for years, and the diagnosis is often made incidentally or when complications have already developed. However, when the 3 polys do occur, they are usually milder and develop over a longer period than in type 1 diabetes. One common but often overlooked symptom of type 2 diabetes is persistent fatigue. Even after getting a full night's sleep, the patient may still feel tired and lacking in energy. This is due to the body's inefficient use of glucose for energy because of insulin resistance or insufficient insulin. Another common symptom is blurred vision. When blood glucose levels are higher than normal, it can cause osmotic shifts in the lens of the eye. This can change the shape of the lens and affect its ability to focus, resulting in blurred vision. Type 2 diabetes also increases the risk of vascular disease, which can lead to slow-healing sores or cuts. Hyperglycemia impairs circulation and immune function, which are both necessary for the healing process. Therefore, wounds may take longer to heal, and minor injuries may require medical attention. Frequent infections such as urinary tract infections, yeast infections, or candidiasis, and skin infections are also more common in people with type 2 diabetes. These are again due to impaired immune function and circulation. Finally, paresthesia, which is tingling, pain or numbness in the hands or feet, can be an early sign of diabetic neuropathy. That's nerve damage caused by chronically high blood glucose levels. Although all of these symptoms may occur in type 2 diabetes, remember that many people, especially in the early stages of the disease, may be completely asymptomatic, and the diagnosis is often made incidentally when a routine blood test reveals hyperglycemia. Finally, let's talk about gestational diabetes. Unlike type 1 and type 2, the hallmark of gestational diabetes is that it's most often asymptomatic. When symptoms do occur, such as increased urination or thirst, they are often mild and easily mistaken for normal symptoms of pregnancy. Therefore, gestational diabetes relies entirely on routine screening tests, such as the glucose challenge test or the A1C test for diagnosis. In summary, the three major types of diabetes have distinct clinical presentations. Type 1 diabetes typically presents acutely with the three Ps, polyuria, polydipsia, and polyphagia, as well as often DKA. Type 2 diabetes is more subtle and often asymptomatic in the early stages, and the diagnosis is made incidentally or when complications have already developed. Gestational diabetes is usually asymptomatic and requires routine screening tests for diagnosis. If you're a student or provider and found this review useful, please share it with your classmates and colleagues. As always, thank you for watching. Stay happy and healthy. Stay.